content and material discussed in these podcasts are for informational purposes only and are not intended to be a substitute for your professional veterinarian's advice, diagnosis, or treatments. Always seek the assistance of your own veterinarian with any questions you may have regarding the medical condition of your pet.
Excuse me, are you in the know? This is a Noman.co production.
Hello, I'm Dr. Gary Clemens, and you're listening to Talking Pets Podcast. Why does my dog or cat scratch all the time? Thank you for joining me today. I will be sharing many of the causes of scratching and itching, such as external parasites, skin infections, allergic skin disease, and possible treatments. Now let's get started discussing what makes dogs scratch. We won't be talking much about cats because they don't get too many conditions that make them scratch other than probably fleas and a few mange mites. As a pet owner, there's nothing much more frustrating than watching your dog scratch and chew on itself all the time. Not only do you feel sorry for your pet, but it can also be very annoying to hear the dog tags jingle as they scratch, especially if you're trying to sleep at night. Skin conditions and ear problems are the number one reason people take their dogs to the veterinarian. Each year, millions and millions of dollars are spent on veterinary visits or over-the-counter products to treat skin and ear conditions. Whenever a dog or cat scratches a lot and the owner takes them to the veterinarian, the first thing most vets will do is rule out external parasites, with fleas being the number one cause. I won't spend a lot of time in this podcast discussing fleas because I went into great detail on my previous podcast about fleas and ticks, discussing the life cycle of fleas and the best products to purchase to eliminate them. But briefly, when a dog has fleas, they usually turn and chew on the skin just above their tail and inside their rear legs. And cats tend to lick right down the middle of their back, over their spine, and you'll often see scabs down the middle of the back on cats. So if you suspect fleas, that's the easiest thing to do is to treat them with a veterinary recommended product. However, if they have a secondary bacterial infection, that will need to be treated as a separate condition by your veterinarian. The next external parasite we're going to talk about is sarcoptic mange, also called scabies, which most of the dogs in Mexico have, and it probably causes the most intense itching of any skin disease. These little nasty mange mites burrow into the skin, causing this intense itch. Eventually, the skin becomes very thickened and raw, and the hair is rubbed or chewed away. Most dogs develop a secondary bacterial skin infection, which also causes the dog to scratch even more, often leaving large open sores on the skin. Most of the dogs in Mexico with mange mites had lesions over their entire bodies. However, dogs in the U.S. rarely have such severe infections because their owners usually take them to the veterinarian before they get so bad. Now, scabies is passed directly by direct contact from one dog to another. It is fairly common in the U.S. in the red and gray fox population, probably also in the coyotes. When owned dogs first get scabies, they usually have scabs on their ear tips and elbows, and sometimes they have pustules on their underside. Another mite that we talk about is the demodectic mange mite, which is passed on from the mother dog to her pups. It's not contagious from one dog to the next, though. The lesions are usually small, focal areas of thinning hair, and usually I'll see those on the face or the head. This condition is often self-limiting or requires minimal treatment, but occasionally it can cover a dog's entire body, especially in immunosuppressed or older animals. Cats can also get certain mites such as Chilatella, but much less frequently than dogs. Later I will discuss treatments. Bacterial skin infections called pyoderma, usually caused by a variety of staphylococcal bacteria, can cause dogs to scratch as well. Puppies get a condition called puppy pyoderma, which is similar to acne in children, and teenage children, that is. They usually have pustules and scabs on their abdomen, between their rear legs, and around the vulva on the little female puppies. Adult dogs usually get bacterial infections secondary to other diseases such as mange mites and allergic skin disease. They will usually have red papules, pustules, and circular scabs, which are called collarettes, on their abdomen, where there's not much hair, and if severe enough, over their entire body. They'll often have scabs down their back, and there'll also be sort of a putrid odor with this secondary bacterial infection. Unfortunately, veterinarians have recently been seeing cases of pyoderma which do not respond to the usual courses of treatment that have worked in the past due to antibiotic resistance developing to these drugs or inappropriate use and dosage of these drugs. When a dog doesn't respond to appropriate drugs, it is best to culture the skin, and often we get results that the infection is caused by MRSA, which is methicillin-resistant staphylococcal bacteria. People get MRSA also. Dogs with seasonal allergic skin disease or even food allergies can also develop secondary bacterial skin infections due to the constant chewing and scratching which damage the skin. There's one more condition I want to discuss that is probably more a result of having allergic skin disease, and this is a bacterial skin irritation where the skin gets raw and inflamed from chewing and scratching. The resulting lesions are generically called hot spots, probably due to the severe redness and inflammation of the skin. These lesions usually occur around the face or over the rump, and later I will discuss how we treat them. Dogs can also develop yeast infections of the skin. However, I've usually seen them secondary to chronic allergic skin disease or chronic metabolic skin disease, such as hypothyroidism, where dogs have low thyroid levels. These dogs usually have very thickened, oily, greasy skin, especially in the armpits, the groin, abdomen, and on the underside. Many of these dogs also have secondary bacterial skin disease as well. And the breeds that I have seen that in the most, I would say Dachshunds are the most common. You'll roll them over, and in their armpits and groin, it looks like elephant hide. And I've seen it in quite a few of the Newfoundlands because they salivate so much, and they'll get this yeast infection from their chin all the way down to their chest. The next topic will be food allergies. Some dogs and cats have allergic reactions to certain foods they eat, which can cause intense itching of many areas of the body, but especially the face, the feet, the ears, and the rear end. Meat protein, which can be any variety of protein like fish, beef, lamb, or other protein source, can be the culprit usually. Unfortunately, the general public has been led to believe that cereal grains are the culprit, and pet food manufacturers have been pushing grain-free diets. There's a condition called dilated cardiomyopathy, which is usually seen in large breed dogs, especially Doberman Pinschers and Rottweilers, and interestingly enough, Cocker Spaniels. In the last several years, veterinary cardiologists have been diagnosing this condition in many breeds they've never seen it in before, and the one common denominator is many of these dogs have been on a grain-free diet. There seems to be something missing in these diets that is usually provided in cereal grains that can lead to this condition. Cardiologists aren't sure why some dogs develop this particular heart disease and some don't, but they are cautioning owners to consult their veterinarians for the recommendations. In our practice, we discourage owners from feeding grain-free diets. Now, don't freak out if your dog's on a grain-free diet. It's a pretty small percentage of dogs that develop this condition. We really don't know which ones will get it. So that's one reason. If you don't have to feed a grain-free diet, don't do it. The last thing I want to discuss, and probably one of the most common causes of scratching and itching in dogs, is allergic skin disease called atopic dermatitis, which is also called atopy. This is usually a seasonal disease in parts of the country that experience 4 seasons and have cold winters. Where I live in Ohio, this condition usually starts in the spring with flowering trees, shrubs, and flowers, and the summertime with different types of grasses, late summer with ragweed, and in the fall, like we are right now, with falling leaves and mold. It can be a year-round problem anywhere, especially if dogs are allergic to dust mites, because you can have dust mites in your house 12 months out of the year. The areas affected mimic food allergies: face, feet, ears, and rear around the anal area. Atopic dermatitis is a complex immunological disease. It is important to know there's no cure for this disease. Let me repeat that for everyone. It is important to know there is no cure for this disease. I think owners sometimes get frustrated, will treat their dog for this condition, and then there'll be another season where they itch and it comes right back. There are many factors involved that make this condition possible. The first is a defective skin barrier. Normal skin has an oil layer that helps repel things that get on the skin. It also fills up those little cracks and crevices in the skin. Dogs with atopic dermatitis have that defective skin barrier. There are cracks and fissures in the skin, which allows allergens to enter. These allergens can be pollens, molds, and other materials. Once they enter the cracks in the skin, the animal's body recognizes them as foreign material, and there is an antigen-antibody response. The dog's body's response is to produce cytokines, which are inflammatory. You probably heard that word cytokines mentioned with the COVID virus. Cytokines are things that cause inflammation, and with the COVID virus, the severe inflammation is caused in the lungs, and that's what a lot of people die from, and that's why they're using a drug called dexamethasone, which is a cortisone, which decreases that inflammation. But in dogs, one of these cytokines is IL-31. This sends a signal to the brain telling the dog to start scratching. So when they scratch, the skin becomes red and raw from the severe scratching and itching. Veterinary dermatologists feel that about 70% of the ear infections in dogs are allergy-related and not a primary bacterial infection or yeast infection. So for all you pet owners out there whose dogs continually have ear problems, talk to your vet about allergic skin disease, because when we get a dog in that has an allergy and we first look in the ears, the opening to the ear is red and the ear canal is very, very inflamed and very red, but there's usually no debris or anything in the ear, so we know there's infection. If owners let it go on for a while, then they get this secondary infection, so the vets see that, they do a cytology, they find out they've got Pseudomonas or staph, and they send home medication for that. And the reason they get better, not only because there's antibacterial, anti-yeast medicine in the drops, but also there is cortisone, which gets rid of the inflammation. So with chronic ear problems, make sure your veterinarian has a discussion with you about allergic dermatitis. I'm so pleased to have you joining us for today's Talking Pets episode about what makes my dog scratch. So far, we've talked about the main conditions that make dogs scratch. Now let's talk about how we address treatment for each one of these. The first thing we have to do is rule out any external parasites, especially fleas. And in the last podcast on fleas and ticks, I went over the new oral and topical flea and tick products, but the newer oral isoxazoline products are my favorites because what happens? They kill fleas before they lay eggs. The adult flea makes up only 5% of the total population of everything in the house, and 95% is made up by the eggs, the larvae, and the cocoons. So if we can keep that old female flea from laying eggs and kill her pretty quickly, we don't get all the others. So we treat it for fleas. Now, if the dog or cat's still scratching, we have to rule out bacterial infections. And this requires treating with an appropriate antibiotic for a sufficient length of time, about 3 weeks in mild cases, and for up to 6 to 8 weeks or even longer for deep pyodermas, which are real severe cases. For decades, cefalexin has been our primary drug and still works well if it's dosed properly. However, there are newer generation cephalosporins, including an injectable drug that lasts 10 to 14 days with one injection, and then you have to go back for another injection. There's another wonderful oral antibiotic in the cephalosporin line that's given once a day, and that has become our favorite also because if we ask people to give a dog capsules twice a day, it doesn't always get done, but they can usually remember once a day. One reason oral drugs don't work as well as injectables is because owners don't always remember to give them at the appropriate time. Also, a weekly shampoo and an antibacterial shampoo is often advised as well. I talked earlier about hot spots. When dogs have hot spots, it seems like we see it a lot in golden retrievers and Labradors because they have a lot of allergies. They often get it right on their cheek and below their ear, and that is a really difficult area to treat because it's so painful. When they come in, the skin's raw and inflamed. There's pus on the skin. They've been scratching. It hurts. They don't like it. So what we would recommend to the client is we like to give them an injection of sedation to kind of put them out for a short time. That way, we can clip the hair away, we can clean the skin, and they don't really feel it because it really hurts to do that. And then once we're finished, we give them an injection, which makes them wake up in about 15 minutes and walk out the door. We usually send home oral antibiotics, sometimes a topical product to dry the skin, and usually medication to stop the itching, because if they keep scratching and itching, it's not going to get better. Yeast infections are treated with shampooing and an oral drug such as Nizoral. So we've ruled out fleas, we've ruled out bacterial infections. If the animal's still scratching, then we rule out food allergies. And food allergies can be ruled out in the beginning if you want to, but you always have to get rid of the external parasites or infections first, because if you don't get rid of infections, you don't know if they're scratching because of the infection or because of the allergy. When we do a food trial, this requires feeding a veterinary-provided novel protein diet, which means a protein or meat source the animal has never been fed before. And this diet has to be fed for up to 8 weeks, and the dog or cat cannot have a single bite of anything to eat except the special diet. No snacks, biscuits, rawhide, or table scraps. This is difficult for family to do if they have small children because dogs can grab things out of their hand or off the table. Let me tell you why I recommend a veterinary diet. Not so veterinarians can make more money because there's not a whole lot of markup on prescription diets, but the veterinary prescription diets are made on dedicated lines. So they only make rabbit on one line, they make venison on one line, they make duck on one line. That way there's no cross-contamination. When they've done testing on over-the-counter foods, sometimes they find out there's another protein in the food, say besides venison, but it's such a small amount they don't have to put it on the bag. So let's say you go to the pet store, you buy their venison, you feed it to your dog for 8 weeks and they're still scratching. We don't know if it's because there's another protein in there or because they're allergic to that food. So start off with a veterinary prescription diet, and then later on, if it works, and then later on you want to try a different source of food, like from the pet store, then you can try it. Because if you know venison works for your dog and you buy an over-the-counter venison, then they start scratching, then you need to go back to the veterinary product. All right, we talked about food allergies, and then we're going to talk about, after the food trial, if they're still scratching, we have to address atopic dermatitis. Treatment for atopic dermatitis requires addressing the itch, and the reason for that is to minimize further trauma to the skin. The main drug that has been used in the past has been cortisone, usually prednisolone. Unfortunately, many veterinarians still give injections of a long-acting cortisone called Depo-Medrol. Now, it's a good drug. It can control the itch for up to 30 days, but it can cause problems if it's used too often and used long-term. So if your dog has, let's say, an allergy in the spring and it only lasts for 3 or 4 weeks, you can get by with a shot, but veterinary dermatologists just don't like the long-acting cortisone. The side effects of cortisone are increased thirst, increased appetite, increased urinating, and panting. So if you give a shot and they have severe side effects, you're not going to get rid of those side effects for about a month. Now, oral cortisone is still good for short-term use, especially if a dog has just short-term allergies. And the drug we've usually used is called prednisone or prednisolone. The way that we would give it in the office is that dogs take it twice a day until they quit itching, which might take 5 to 7 days. Once they stop scratching, then the owners reduce the dose to once a day for maybe 5 to 7 days. If they're still not scratching, then the owners give it every other day or less often. As you decrease the dose of cortisone, those side effects of increased thirst, urination, and wanting to eat everything will become decreased as also. Frequent bathing is important to wash off allergens, and fatty acid supplements are important to improve the skin barrier. There is a newer treatment. When I say new, it's probably about 7 years old, called Apoquel, and this has really revolutionized the treatment of atopic dermatitis. It essentially blocks the cytokine IL-31, which I discussed earlier, from sending those signals to the brain to tell your dog to start scratching. There are few side effects, and scratching stops within maybe 4 hours or so. It's an oral drug given twice daily until the scratching is under control. Then it's given once a day. It is for dogs over 1 year of age and not recommended to give to dogs with cancer or immunosuppressive disease. The company that produces Apoquel has an injectable product called Cytopoint that works in a similar way. The same as Apoquel, this product is a non-cortisone product, so there are very few side effects. The initial injection usually lasts anywhere from 21 to 28 days, and it can be followed up by 2 more injections, and each one seems to last a little bit longer. You can discuss these new products with your veterinarian. However, most veterinarians have been using them for 6 or more years with very favorable results. There's another class of drugs called cyclosporins, which can be used, and they work pretty well, but they take longer to work, and some dogs vomit the medication. Veterinarians can also take a blood sample to find out what your dog is allergic to, and then if they are allergic to certain things, the company can make Bactrin, which is given as an injectable product to your dog. I think they're even working on wafers that they can take early on. So that seems to work pretty well. And it's something that the veterinarian can do with a blood test. And you can always ask for a referral to the dermatologist as well, because they can get to the source of the problem pretty darn quickly. If your dog or cat has skin disease, please don't delay treatment. You can treat for fleas, but if your dog or cat is still scratching and uncomfortable, please do your dog a favor and schedule an appointment with your veterinarian. Thank you for listening to this podcast. So far, we've gone over many reasons why your dog itches and scratches. When we come back, I'll answer some of the questions I received from listeners. I will start with the ones I've heard more often over my years in practice from my clients. Our friends at Odor Exit have generously offered, for our listeners only, a bottle of their amazing odor eliminating product, Odor Exit, and an ultraviolet black light to find those pet urine stains. This is a $50 value. In my 46 years as a veterinarian, I tried many products that were supposed to eliminate pet odors, but none of them worked as well as Odor Exit. Entering to win is easy. All you have to do is like and share my Facebook page, Talking Pets with Dr. Gary Clements, with one friend. That's it. One winner will be posted monthly on my Facebook page. Good luck and thanks for sharing. Welcome back. Thanks everyone for your questions. Since this is a podcast, give me a call on my call-in line. The number is 304-TALK-PET. That's area code 304-825-5738. If we answer your question on this podcast, we will be sure to include your voice message. Please call us with your question at 304-TALK-PET. I'm Dr. Gary Clements with Talking Pets, and occasionally we get questions from our listeners, and we have a question from Helen R. Helen asks, why does my cat rub on me and everything that I own? You know, that's a common thing. Cats always rub on us. They like to do that, I think, so they can get hair all over your clothing. But really, cats actually have scent glands in their cheeks, and they use their cheeks to rub on things to leave their scent or to mark their territory. They do that out in the wild, and that's a way for them to say, keep away from this territory, it belongs to me. So when a cat rubs on your leg or maybe on your furniture or on the corner of the closet, they're saying that they love you. When they rub on your leg, they're saying, this is my owner, I love her very much, and don't anybody get near her. When you have a multiple cat household, cats rub on things to try to keep other cats away. And sometimes we force cats to live in unusual situations where there's too many cats and not enough enrichment for them. So they will actually rub their cheeks on things to say, this is my part of the house, you stay away. The other thing they often do, Helen, is they often use their claws and they'll scratch on things. Out in the wild, cats will scratch on a tree, they'll scratch on a fence post, and that's another way that they mark their territory. So sometimes in the house, when your cat runs up to the chair and scratches on it, he's trying to mark that territory, particularly if there are other cats in the household. So it's a very common occurrence, and it's not an unusual thing. So when your kitty's doing that to you, just realize that your cat loves you very much, and get a nice hair removal thing so you can get the hair off your leg. So thanks for your question. Thank you very much. This one comes from Mary B. This is kind of a funny one. When I used to have the radio show, people would ask this all the time. And her question is, Dr. Clements, why does my dog scoot his butt across my carpet? Well, there's many reasons. I think the number one reason is they like to leave skid marks to see the expression on your face, particularly if you have company coming. So, dogs have to have a little bit of fun in their life, and that's one way that they do it. There's actually other reasons why they do it also. One is dingleberries. Now, I'm not trying to be funny, but long-haired dogs will often get a little bit of poop stuck in the hair around their anal area. So if you have a long-haired dog and they're scooting, first thing to do is lift up the tail and see if there's any dingleberries there. And if they are, very carefully use some clippers or take your dog to the groomer and have that hair clipped away. And I always tell people with long-haired dogs, it's a good idea to always keep that hair trimmed away around the anus because they do get fecal matter stuck in there and it's hard for them to get it off. And sometimes if the butt itches too much because of the fecal matter, they will scoot their butt across the floor, and that's how they leave the skid marks. Another reason dogs scoot their butt is because they have seasonal allergies. And the areas that are affected with seasonal allergies can be their face, their feet, their ears, and their rear end. So they can scratch at their ears, they can rub their face on the furniture, and they often will scoot their butt on the ground. If it's a seasonal allergy and you lift up the tail, what you'll usually see is a red, inflamed anal area, and that's an indication that your pet might have seasonal allergies. The other thing you can do if you suspect seasonal allergies is if they're showing those symptoms, certainly call your vet. If you lift up the foot and look between the foot pads with seasonal allergies, they tend to chew between the foot pads and the area will be red and inflamed. And most seasonal allergies, at least in the Midwest, occur in the spring and the fall. Spring with tree pollen and things like that get on the ground. And in the fall, we have ragweed and we have molds from leaves falling. So those are things that can help cause seasonal allergies. Another thing that can cause dogs to scoot their butt are impacted anal sacs. Now that's SACS, anal sacs. The anal sacs are almost like scent glands in a skunk. They're very similar. Skunks use them to, as you know, if somebody gets too close, they'll spray. Dogs have the same type little glands on both sides of their tail. If you lift up the tail and pretend the anal opening is a clock, there will be an opening at 4 o'clock and 8 o'clock. It's a tiny, tiny little opening. And when dogs get excited or fearful, they can actually express their anal sacs, and they can also do that as a marking type thing. Now, if the anal sac material is thin, it comes out pretty easily, but sometimes the anal sac material is real thick. It's almost like putty, and the anal sac gets bigger and bigger and bigger. In small dogs, it's like a tiny little grape. In bigger dogs, it's like a very large grape. And as that anal sac gets larger and larger and they can't express it themselves, they will often scoot their butt on the ground to try to put pressure on their anal sac to try to get it to empty. When you check your dog out, if there's no dingleberries, there's no inflammation from allergies or other symptoms of allergies, and they're still scooting their butt, then call your veterinarian. And sometimes groomers will try to empty out anal sacs, and I never fault groomers when they don't do it completely. The veterinarian technician or assistants will put on a rubber glove, or the veterinarian will do a rubber glove, lubricate their finger, stick the finger in the anal opening. They can feel the anal sac between their finger, index finger, and their thumb. And then if they gently squeeze it, they can get that anal sac to empty out. Now, sometimes dogs get infected anal sacs. If they get an infected anal sac, one side will look really red and inflamed and swollen, and sometimes they just rupture and break open and a real foul-smelling material comes out, and it can leave a hole next to the anal sac as big as your thumb. That's not unusual. When dogs normally excrete their anal sacs on their own, sometimes they'll be sitting on your lap and suddenly jump down and lick at their butt, and then you smell something on your lap that smells like rotten fish. Well, your dog just expressed its anal sac. So, Mary, thank you very much for that great question. This is Dr. Gary Clemens with Talking Pets. We have another question from Shirley P. Shirley says, my dog hates the mailman. What can I do? Boy, that's a common thing. Our two little dogs, Archie and Annie, used to bark at the mailman all the time. So what did we do? We bought Jeff a box of dog biscuits, and our mailbox is right on our front porch. It's a little one that hangs on a post. So whenever Jeff comes, he leaves a couple of biscuits for the dogs. So now when they see Jeff, they're so excited. Now, that's not going to work for everybody because sometimes you have your mailbox out at the road and the dogs see the mailman. And what happens when they bark? It makes the mailman go away. So that reinforces that barking behavior. So it's very difficult to deal with. If you're home and the mailman's coming and the mailbox is out by the road and the mailman's not going to come up to the door to give your dogs biscuits, well, what I recommend is get some really tasty treats whenever you see the mailman coming. Bait the dogs with those treats and say, sit. Make them sit. Say, good dog. And try to make them sit longer periods of time and keep giving them little pieces of treats when the mailman's coming. And eventually the dogs are going to associate the mailman with the treats. Or you can have the dogs, when they see the mailman, go to a quiet place like their bed and have them lay down in the bed or lie down in the bed and then bait them with the treats there so they can go to a safe place where they don't see the mailman. If there's a mail slot in the door, which some old houses still have, you can leave dog biscuits out by your front porch or by the front door, and then have the mailman put those through the door with the mail, so that when the dog sees the mailman coming, he associates it with a good thing. And it's just like Pavlov's dog in Russia. When they would ring the bell, the dogs would salivate because they would give them food. So they would associate the bell with the food, and that, of course, that made them salivate. So, do your mailman a favor, get some biscuits. You can do the same thing with the delivery people, and that helps with dogs that want to bark when delivery people come. Hey, this is Dr. Gary Clemens with Talking Pets. Occasionally we get questions, and we have a great question that came in from Hannah R. from Brooklyn, New York. She says, why does my dog's breath smell so bad? That is a common question that we get all the time as veterinarians. Well, Hannah, since dogs don't brush their teeth twice a day, and most owners don't brush their dog's teeth at all, there's always going to be some unpleasant odor with their mouth. And sometimes, dogs lick their butt, some dogs eat their own poop, different things like that. That can certainly create a foul breath. Even with a young dog, when dogs eat food, some of that food will stick up on their cheek or it will stick up next to their upper canine teeth. Bacteria eat that food right at the gum line, and the bacteria in the mouth will produce a sulfur type odor, which is really, really foul smelling. And it creates a little pocket between where the tooth meets the gum. And if you look at that area in your dog, it can look a little bit red, and that's what we call gingivitis, and that's caused by that sulfur producing bacteria that live underneath the gum. The other thing is dogs get older, some of the food accumulates up in their cheek and also by their upper canine teeth. And eventually you get a deposit, it's called calculus, and it can look like a brown material. And that will smell bad also. So what I always recommend is lift up your dog's lip and look at the teeth. If you have an older dog, make sure you look at those teeth in the back, upper teeth in the back. The fourth upper premolar is the one that accumulates most of the calculus and the upper canine tooth. If you see a lot of calculus build up, and particularly if the gums are red, then your dog needs a professional dental cleaning. I don't mean by a groomer, I mean by a veterinarian. And the proper way to do it is to have the dog anesthetized so they can crack that calculus off, use dental instruments to go up underneath the gums to scrape away all that calculus and tartar that's under the gums causing the gingivitis, and then do a good polishing to get rid of that problem. So you have to examine the dog. Now, if you have a young dog and you just see a little bit of redness in the gums, then that's what we call gingivitis. And it's hard to get people to brush their dog's teeth. And what we do with Archie and Annie is we brush their teeth once a week, and then every 2 weeks I trim the tips of their toenails. So buy some doggy toothpaste. You can use if you have a small dog, just get a child's toothbrush. I don't like finger toothbrushes because the bristles are too big and they don't really get right at that crevice between the gum and the tooth. So get a regular toothbrush and try to brush your dog's teeth at least once a week. The other thing that really helps is giving dogs things to chew on. Now, the things that dental veterinarians or veterinary dentists don't like are things that can break the teeth, and those are cow hooves, some of the hard nyla type bones. The natural bones are bad also. So actually rawhide is good to help clean their teeth, but make sure the rawhide is from the US. And whenever you give the dog a rawhide the first time, make sure you're there with them so they don't try to eat the whole thing at the first time. When the rawhide gets into the stomach, eventually the acids break it down and the rawhide will be dissolved. But the thing I want to leave you with is if your dog has really red gums or a lot of calculus buildup, please call your veterinarian and let them do a professional cleaning on your pet. Hey, this is Dr. Gary Clemens with Talking Pets Podcast. We have a question that just came in from William B. from Jamestown, Kentucky. William says, why does my dog eat his own poop? I used to get that question on the radio all the time. People were always embarrassed to ask because they thought their dog was some kind of a demon for doing it. Well, the real answer is your dog thinks it tastes good. We think that's kind of gross. Some people feel that there's deficiencies in the dog food that they eat, so they eat their own poop. And, there may be some truth to that as well. When a female dog has puppies, she cleans up after her puppies. And the reason she does that, when she licks their butt, it makes them eliminate, and then she licks up the poop. Dogs that live in the wild probably do that, or a fox or a coyote or wolf, because if enough poop accumulates, other animals can be attracted to it and would kill their puppies. So when the female cleans up after the puppies, that eliminates that odor, eliminates the poop. So if a dog has had pups before, that's one reason they might want to eat poop. I always tell people they either eat it or roll in it. And, it's gross if you take your dog out in the field or out in the woods and they find some droppings from another animal. They always roll on it and they get it on their neck and on their shoulders. And I think they probably do that as an ancestral type thing in order to mask their own odor. So if you're a fox and you're going to get eaten by a coyote or a wolf, you want to cover up your own odor. And if you roll in something, that certainly covers it up. Now, when dogs eat their own poop, it really is usually not a deficiency. It's more of a behavioral issue. There are over-the-counter products that are sold that you put in the dog's food that are supposed to help digest the food better. I don't find that they work at all. Some people say you can put raw pineapple juice in the food and that acts as an enzyme to break down the food better. I haven't really found owners tell me that that works well either. The basic thing is you've got to pick the poop up before your dog gets to it. Now, that's not always easy. If you walk your dog on a leash, that's easy. If your dog goes out in the yard to poop, it's kind of hard to do it because if your dog's 50 feet away, they poop and they turn around, their mouth goes down to the ground. Sometimes you can't get to it in time. What I recommend is you can use a bicycle horn. If you don't have neighbors real close, you can use an air horn. And when they poop, if you see them even going towards the poop, make that blast with the bicycle horn or the air horn, but don't let the dog know you're doing it. You want them to think every time I get near that poop, there's going to be a loud noise that frightens me. So you have to put the horn behind your back. If you're a disabled or a senior and you can't go outside, that can work pretty well. The other thing you can do is whenever your dog poops, as soon as they're done, call them to you and give them a wonderful treat that you only utilize when they poop outside. And that can be little bits of a hot dog that's chopped up. It can be, some special treat you buy at the store. So just call them, reward them for coming back to you. And then when you have time, either you or someone can go outside and help pick up the poop. So your dog doesn't have any medical problem. It's just more of a behavioral problem. So William, we thank you very much for that question. Thank you so much for joining me for today's podcast. I will post it on my Facebook page, Talking Pets with Dr. Gary Clemens. If you have questions about this podcast or suggestions about future podcasts, please post them there. So for now, I'm Dr. Gary Clemens. Please consider adopting your next pet from a rescue group or animal shelter. Spay neuter your pets, and if God's willing, I'll be back soon with another podcast at Talking Pets with Dr. Gary Clemens. And for now, so long, love your pets with all the love they deserve, and have a blessed week.